So here's everything that I did to help get rid of my lower back pain from my L4, L5 herniated disc. First of all, I'm not a doctor or a PT, so this is just what I did initially to help get me started. The first thing I'd recommend is to invest in a solid heating pad, preferably one that covers your entire spine and neck, that wraps around your shoulders too, because this will help loosen up all your muscles that are very tight right now, likely because they're protecting your back injury. So the heat will loosen up your muscles and allow you to do the next exercises that I'm about to talk about. The first exercise is Deadbugs, which is one of the most important exercises for strengthening your core when you have a back injury. The first 2 reps I used 5-second holds, and then I moved on to 10-second holds because I've been doing this for about 4 years now. If you're just starting out, make sure to use the 5-second holds to start. My first major tip is to keep your back flat against the ground. Do not arch your back. My second tip is to exhale slowly when you're extending your arm and leg. Breathe in when you're retracting them. So make sure to do 30 reps of 5-second holds. You should really feel this in your deep core and your hip flexors. This is another exercise prescribed to me by my physical therapist. This exercise is called Glute Bridges, and it's pretty self-explanatory. I have a resistance band wrapped around my knees. I have my heels planted firmly on the ground with my feet flat. And you're going to drive upward with your glutes and your hips until your body is straight. 30 reps. This is called the Banded Clam, and it helps stabilize your hips to support your spine while strengthening your gluteus medius and minimus. You want to do 30 reps on both sides. Make sure to like and follow if this helps you, and to see the rest of my physical therapy routine. This is a modified plank. Notice the 90-degree bend in my knees. This makes it a little bit easier for you as you start your PT journey, as planks are going to be one of the hardest exercises as they really test your core endurance. So this will be 3 sets of 30 seconds as this works your anterior chain, your low back muscles, your glutes, and your hamstrings. Now I'm moving on to the side plank modified version. My knees are still bent, and this will work your obliques. Just keep in mind that this was one of the hardest exercises for my PT journey, especially at the beginning, and especially when I started moving on to fully extended planks. So just keep that in mind. 3 sets of 30 seconds, front, left, and right, so each one will have 3 sets. And then after those exercises, we would go right into piriformis stretching. Here's the piriformis stretch. Start with your feet flat on the ground, cross your ankle over your knee, grab your knee or your thigh, pull your leg back towards your chest, and you should feel this in the back of your hips and the buttocks area. This was one of the most pain-relieving stretches that I had experienced when I had my injury. Make sure you're breathing deeply throughout this stretch, and what was recommended to me was 3 sets of 30 seconds for each leg. A supine glute stretch. So this one, you'll start with your feet flat again, bring your ankle on top of your knee, and your left knee, you're going to bring it towards your right chest. Pull it across your body, and really you're going to feel this one on the side of your hips, on the side of your glutes. This one as well is going to be 3 sets of 30 seconds each. Make sure you keep your ankle on top of your knee as much as you can. Here's the right side. And yeah, just keep making sure you breathe deeply throughout all of your stretches and exercises. You never want to hold your breath because you need your oxygen to get to your muscles and ligaments. And also the hip flexors are another one you should stretch as well. I believe this is called the Prone Hip Flexor Stretch, and this one is very beneficial because it allows you to stay laying down and you don't have to stress your lower back too much. You get one of these specialized bands here that wraps around your ankle, and so you're gonna pull your foot backwards, kind of like a quad stretch, but you're Gonna feel it in your quads and your hip flexors, and you're gonna do 3 sets of 30 seconds for each leg. And if you don't have one of these bands, I'm gonna show you a different way to stretch your hip flexors right now. This is called the kneeling hip flexor stretch, and I like to raise my arm up to get a really nice stretch in the front of your hips and quads where your hip flexors are. Make sure you keep your posture upright as much as you can. I like to kind of lean to the side a little bit, but if that hurts, definitely don't do that. 3 times for 30 seconds each side. This is the prone extension. My physical therapist had told me that this was one of the most important exercises, if not the most important for my situation. So you're going to press up with your arms while keeping your hips and legs pressed against the ground. This is going to stretch your front abdominal muscles all the way up and down, which is very important for your posture so you don't hunch forward. You're going to do 10 sets of 10-second holds. You can keep your feet flat or you can have your ankles bent, whichever feels comfortable. You've made it to the last and final exercise of this PT routine for phase 1. This is called child's pose. This one's really going to help relax your lower spine after you've been working on all those muscles around it. So you're going to get on your hands and knees and basically bring your butt back to your ankles, and you're going to hold for 10 seconds. So 10 sets of 10-second holds, just like the prone extension. If you want me to elaborate any more on any of those exercises or stretches, just leave a comment and I'll talk more about them in detail. And so this routine I would do every day if I could, and each session would end with about 10 to 20 minutes of ice directly on your lower back, wherever your herniated disc is. But make sure you wrap your ice pack in a towel. The next few things I would recommend for this beginning stage would be to stay hydrated very well. Drink a lot of water and drink your electrolytes, because your disc needs water and it's made of water, so you definitely need hydration. The next thing you would need is a full 8 hours of sleep at least every single night, and that's very important so that your disc can heal, and that's the only time where your disc is really decompressing. And when you're sleeping, make sure to try to lay flat on your back and have a pillow underneath your knees so that your knees are elevated and your back is neutral. The bonus thing I would recommend is to start taking magnesium glycinate, because as I mentioned, your muscles are very tight when you're dealing with injuries like this because they're protecting your spine. So magnesium glycinate will help with your sleep by helping your muscles relax, and that was a very difficult thing for me because I was not able to sleep in the beginning because my muscles were super tight and I just couldn't relax because of the pain. If you made it to the end of the video, thank you so much. Remember to subscribe, like, comment, ask me questions about anything you need more explanation on, and maybe I'll make a dedicated video for it. Remember, I'm not a doctor or a PT, and this is just what worked for me in my experience for my specific injury. If you enjoyed the music in this video, the best way to support me is to download the MP3s on bandcamp.com. That'll be the first link in my description. There you can name your price, like it, subscribe, follow me on your favorite streaming platform, whether that's Spotify, Apple Music, or here on YouTube. Add me to your rehab or workout playlists, and that way I can help you through your recovery journey even more. So the next videos I'm going to be talking about myofascial release, mobility, specifically hip mobility, and then I'll be talking about diet and supplements that really helped me out. So yeah, subscribe, and good luck on your journey.